Perfect. We're live with Patrick Quigley, co-founder and CEO of Sidecar Health. It's awesome to have you here today, Patrick.
Well, John, thanks so much for having me.
Yeah, I'm excited to dive in. Lots of interesting things to cover in the world of insurance. Maybe we can start off with a quick intro on yourself, maybe background bio, and an overview of what you're doing at Sidecar.
Absolutely. Well, by the way, I love it when people start with like lots of interesting things going on in insurance, a statement that is not often said, right?
Yeah, I think it's interesting. We're all paying, or many of us are paying hundreds of dollars into the system every month. We don't always there's a lack of transparency. We don't always know what we're getting on the other end of it. There's things that aren't covered. Um, I think that makes for an interesting conversation when someone's doing something to disrupt that world.
Well, I obviously totally agree. It's just that not everybody thinks insurance can be sexy and invigorating. But when you put it into the context of the fact that it is essential for all of our lives, especially when you talk about health insurance, obviously there's a lot worth talking about. But happy to give you the 2-cent tour, kind of how we got here and kind of a little bit about me, if that was what was helpful.
Please.
Yeah. So I mean, I think really about myself as a builder. If that makes any sense, I'm an engineer by training, a mechanical engineer, which doesn't help me a lot with coding. But I've had the privilege of being able to build 3 companies and work with some of the same people. Actually, my co-founder is from a company 3 times ago, and so we're building kind of across these 3 companies together. And so, really, I feel like as an engineer, as a builder, and I guess a serial entrepreneur in that context, I really feel like all the experiences that I've had to date have kind of built on each other to allow us to create Sidecar Health. And we're just really excited to have an opportunity to chat with you about it.
Amazing. And were those businesses in the insurance world? How did they lead you to what you're building today? I know a bunch of questions wrapped in, and maybe an overview of what Sidecar does.
Yeah, absolutely. So those businesses all touched insurance, right? So those businesses were all marketing businesses that really enabled people to connect, consumers to connect with the right insurance product for them. And the creation of Sidecar Health actually came out of our last business, which actually focused on connecting consumers with all the major national and regional health insurance products. And what we had found is that consumers just didn't like the choices that were available to them. Right. So, I mean, I think we can all agree that health insurance is really expensive. It's really complicated. You can't always see the doctors you want. There's surprises. And so we kind of set out to solve that particular problem. And the solution actually literally came out of my personal experience. And it caused us, Veronica and I, my co-founder, to kind of wrap up and sell actually the last company that we had started or were building. And actually start Sidecar Health to solve, we think we can solve the health insurance problem, and more importantly, the healthcare problem in the United States. And all came from that last experience.
Fantastic. And then, you have this idea through this marketing sort of ecosystem. Sounds a little bit like Policy Genius. Was it like in that world?
In that world, the last company? Yeah, I mean, I suppose a little bit. I think would it be helpful for me to kind of explain what Sidecar Health is?
Please.
Yeah, it'll just be a lot easier. So Sidecar Health is a totally new approach to health insurance. We kind of think about it as health insurance that's finally fair. So what we do is we give people the money they need to buy care when they need it. And we combine that with the information they need to make care decisions, really for the first time. And so on a practical basis, we give people a Visa card, right? So this is mine. And this Visa card is special because it connects directly with our claims account. So effectively, people are walking around with an entire insurance company in their wallet. And with that buying power, they can actually go access care. What most folks don't know is you can pay for care directly. And when you do, it's dramatically cheaper. On average, what we've seen through our experience, our members' experience, as well as through academic research, it's about 40% cheaper, which is kind of unbelievable. And insurance, as you know, is just a math equation. And so if we are entering into that math equation with 40% lower costs, you can provide an insurance product that starts at 40% less. And that's dramatic because you think about the challenges in the US healthcare system, it's affordability. And so our product enables dramatically better, affordability than other health insurance products. But it can't just be about the buying power. It has to be about the information. And so what we do is we combine it with an app that tells people what any procedure, any prescription drug, anything should cost in the US healthcare system, and what our benefits are. Complete transparency on the benefits, if you can imagine that. So our members are never confused about what their coverage is, what's covered. And we end up with these 3 big benefits, which are affordability, because it's a lot less expensive. It's a more robust health insurance product, right? We're very proud of the fact that we offer the most robust health insurance product available in the US. For example, we cover every drug approved by the FDA. And then at the same time, we provide better access, because a real challenge in the US healthcare system is how do you go ahead and get access? And everybody takes Visa, so you can see any doctor you want. And so that's really what the company is all about. Our mission is to lower the cost of care for everyone in the US, while at the same time raising access to everyone, because everyone needs care.
So cool. Why is out of pocket, paying directly and not through insurance 40% cheaper?
Honestly, it's just because the US healthcare system has a tremendous amount of additional administrative costs.
Okay.
And so there's lots of academic papers on this. I mean, one of my favorite stats is 40% of doctor time is spent filling out paperwork.
Wow.
And no doctor entered the medical field to want to fill out paperwork or TPS reports, right? That's not what they're there for. And so the reason why cash pay is on average cheaper, and by the way, it's not always cheaper. It just, like, some stores charge more than other stores. Like Whole Foods is more expensive than Safeway. But on average, it's about 40% cheaper because you don't have, the additional administrative costs of the provider waiting, trying to go back and forth with the insurance company. Anybody that's engaged in the healthcare system knows, like, bills go back and forth, and some of them are real and some of them aren't. It's just a lot of paperwork. And the second thing is providers have to wait to get paid from insurance companies. So they value getting paid up front.
Got it. Is that why I think GoodRx takes a similar model? Like, I've gone to get prescription medication, and I've given them my insurance, and they're like, okay, it's $16. And then I've given like a random GoodRx code, and I kind of understood that it worked, I think, in a similar way. And then it was like $10 through the GoodRx network. Is that also because they're paying directly? Is it a similar sort of business model in some way?
GoodRx is a phenomenal company, and what they're doing is bringing transparency to product pricing in pharma. Because what people don't know is, like a drug, let's say not to pick on anybody, let's say at a CVS or Walgreens or whatever, might have a dramatically different price than a drug at a Safeway or a Walmart, right? And so what GoodRx has done an amazing job at is bringing transparency for the first time to people understand there is these pricing differences, and because of their relationships, they may have lower pricing than your than your traditional insurance product.
Yeah.
But GoodRx is just providing information. They're not providing the insurance product.
Yeah,
well,
and
we take that to the next level, because we actually pay for the drugs, right? We pay for the medical services as well, while at the same time providing a higher level of transparency, not over on the prescription side, but also on medical services.
So as a consumer, I come to Sidecar Health. I set up an insurance insurance coverage similar to as I would go through a bigger insurance company like an Aetna or Cigna or Blue Shield, and your prices are typically 40% cheaper. And then am I paying a monthly membership similar for the coverage? Am I also paying co-pays? Can you walk us through a little bit of like what the user experience typically looks like for Sidecar members?
Yeah, I'd be excited to. So yeah, we're an insurance company. So we offer an insurance product. So our members pay a monthly premium, right, for coverage, and then they get benefits for that monthly premium. And that's how the product works, which is the same as every other insurance company, whether it's a major health insurance company or an auto insurance company. That's how insurance works. But our product is dramatically different than a traditional insurance product in that we basically go into a market and we look at the market and we basically build our benefits based on the average cash price for every benefit you can for any medical service, any prescription drug you can do or get in that particular market. And so then what we do is we enable consumers to, knowing that benefit, can go engage with the healthcare system. And if, let's take a very simple example. Let's say in Texas, you are going to get you want to go see your doctor because you're not feeling well. Let's say our benefit is $180, right? And so knowing that information, you can go engage with your doctor, and that doctor may charge $150. That doctor may charge $200. We pay $180. And if you shop around, the way that we've set up our product is that half of doctors are going to charge less and half of doctors are going to charge more. And so if you decide to go to a doctor that's more expensive, you know immediately what your portion is, right? So let's say you chose to go to a doctor that charges $200. So you know your portion of that medical service is $20. Similarly, if you decide to go to a doctor that charges $150, our benefit is still $180, and you actually keep the $30. So it is a fundamental different way of thinking about healthcare. What we're doing is, and that's why we're called Sidecar Health, right? We're putting consumers in the driver's seat for their health. We're just the sidecar. We're giving you the information and the money to engage with the system. It's your choice of how you do it. And what we find, and this is why we're so different than every other traditional insurance company, is that we find that members are so actively engaged in what they're doing, right? And they have the freedom and the ability to kind of engage with the system in a knowing way. There's no surprises because they're the ones paying, and we're simply there helping them make these decisions, whether they're simple like an office visit or complicated like a knee surgery.
It's fascinating. So just to repeat it back to you, like, let's say for something like mental health and therapy, you all have done the research, have basically an average price for a therapy visit. And let's just say it's $80 for an hour of therapy for mental health support. And then if I will then look for providers through the Sidecar network. If I find a provider that is $60 an hour, you'll actually give me $20 back every time I go to that provider. If I go to a doctor or a therapist that's $100 an hour, I'll pay $20 out of pocket in addition to that $80.
Yeah, that's exactly right. It's even better than that. There's no such thing as the Sidecar network. That's one of the things that we find is very important, is that we do not want to determine care. We do not want to determine where you need to go. That is for you to decide, and you and your doctor decide. And so you can go engage with any doctor you choose that you want to. And the way the economics work is exactly how you said it, right? So you know the benefit, and if you choose to go to whatever doctor you choose to, that $80, right, is effectively, you can kind of think about it. Our members kind of think about it as their money and say, how do they want to spend their money?
It's fascinating. Why has it taken so long for the insurance system to operate in this way? Like, why was Sidecar created, a few years ago and not 10 or 15 years ago? Is it technology? Is it, mindset? What impacted that?
I think it's all of the above. So let's take the easy thing. So from a technology perspective. So from a technology perspective, as I know from your background in fintech, like, the technology is non-trivial, right? So the ability to actually enable people with the information of what anything in the U.S. healthcare systems can cost and what your benefits are right in the palm of your hand is complicated. Building the whole financial kind of transaction system to enable people to access that money at their discretion, through their process when they're needed, is non-trivial. So there is a technology, a real big component of technology that's required. Like, everyone needs to have a computer in their wallet, right? Or in their hand to be able to access this and have information to engage. So there is a technology component. There's also kind of a cultural component too, right? Which is the way that our healthcare system continues to evolve. We have moved as a country to high deductible health plans, right? We've moved to a situation where we have 30 million uninsured Americans, right? And so the healthcare system over the last 5 years has actually become more and more accustomed to people coming in and saying, hey, doc, I'm going to be paying for this myself today. What's it cost? And so that's created a dramatic shift, because so many people are, you could say, not only uninsured, but underinsured, or they're on high deductible health plans, that the system has caught up to cash transactions where, again, everybody takes Visa. So it's the combination of the market being ready because of consumer changes, with technology for the first time enabling this to happen. And I would say the third thing that's going great is, from a regulatory perspective, is you have a real push from the Biden administration, from the CMS today, for transparency, right? And that's critical. Like, it's not just about how do we make these decisions, which are usually very expensive, transparent, but the awareness that there is difference in pricing is critical to consumer education that enables a product like ours to be transformative in the conversation around engaging, the healthcare system.
And Patrick, I think there's also a conversation to be had, or things that Sidecar is answering on the provider side, right? There are probably hundreds, thousands of providers in the United States and that do not accept insurance because of the trouble of engaging with the insurance system. And I bet you're also providing them, a more seamless way to engage with a new group of customers or patients.
Absolutely. I mean, providers love us. Like, think about it this way. Our members are price takers. There's no big insurance company saying we won't pay for this, or we won't pay that much, or that's unfair. Our members are saying to their doctors, hey, doctor, I need to come in for an ACL repair. I'm going to be paying for this with my Visa card today. What's your price? And so the provider is saying, I'm willing to do that surgery for $10,000 or whatever it is. And the consumer is then making a decision about whether they want to pay that money or not. And so providers get paid up front, and they get paid the price they want, which is great. And then the second reason why I think this is a really good thing overall for providers is, you'd probably be surprised, but in the US healthcare system, there's no correlation between quality and cost. Can you believe that?
Yeah. I've heard. I keep hearing that again and again and again, and it's
a little unfair, right? Because, like, if you're delivering an amazing service, because your customer, your patient, is not actually buying the product, they don't know what the price is, they're not involved in the deciding of the price, then you're not rewarded for delivering the great product. And so what we're doing is, by actually creating healthcare as a true consumer product for the first time, our members, and we can see this in our data, will choose to pay more for providers they value. And that is unbelievable, because then providers can start to be rewarded for that behavior, just like every other market in the economy, where great providers providing high quality services are rewarded with better economics than those providing lower quality services. But in healthcare, that doesn't happen today.
How has the pandemic impacted trends around? Has it been positive? Has it been negative around price transparency, health insurance, affordability of care? I think many of us have experienced things like going and getting a COVID test and that being covered by insurance. But maybe at a higher level, like how COVID has impacted how folks think about insurance and how Sidecar operates.
Yeah, I would say there's two big impacts that it's had. First, is it's raised the awareness for everyone that everyone needs insurance. Everyone deserves access to care. And now it's much more top of mind, right? Because there is a continuous, very real, affecting every one of our days, every day, healthcare threat in COVID. And so that brings the need for healthcare forefront of everyone's mind, which is great. Because whether you're choosing Sidecar Health or choosing someone else, like, everybody, let's go get insurance. Let's make sure people are covered, right? Yeah. And then the second thing for us is that, and you used a COVID test as a great example. And I'm sure you've seen the articles. There was a great one in the New York Times last year about a couple that went in to get a COVID test. And, one of them paid with their insurance and one of them paid with cash. Same location. They did it together. The one that paid in cash was charged $199. And the one that paid with their insurance was billed $6,400. Yeah, right? It's crazy. And you go look it up. It's in the New York Times. There's a great article. The punchline actually is the person that paid with their insurance, they were actually balance billed around $3,000 because their insurance was only willing to pay like $3,000 of the coverage. So, but if that individual had just paid with cash, they would have been charged $199. And so I think that the other thing that's becoming really clear is, and one of the great things that the current CMS is doing around transparency is allowing people to understand that pricing differences are dramatic.
Mm.
And let's just make sure we are aware that pricing differences are dramatic. And I think with COVID testing, again, being a regular thing, like this is a great example of all us understanding that we need to continue to facilitate changes in the US healthcare system, because there are some real things that work well, but there are some things that we could be doing better around costs.
So interesting. As you think about the future of insurance, do you think it's going to be a model that's employer based, or do you think that it's going to be more of folks, kind of covering their own insurance? And do you guys have employer clients at Sidecar yet?
Yeah, absolutely. So two questions are like, what do we think? Where do we think the world's going to go? Right now, about half of Americans get their insurance through employers. And do we see that changing over time? I mean, we do. Maybe over 20 years, that kind of model could shift. In the U.S., everyone used to get their retirement through their employer, and now with 401k and IRAs, it's done differently. So I can see a world where it becomes less tied to your employer, and wouldn't that be great? Where you could actually take your healthcare with you potentially. But I don't think there are advantages, I think, to getting it through your employer as well. So it could go either way, but I can see pros and cons. From our perspective, our mission is to cover every American, right? And we're going one market at a time. We kind of think about it a little bit like Tesla did, right? So when Tesla started out, their first car was the Roadster, which was really a Lotus that they ripped out the innards of, if you maybe remember, and they put in cell phone batteries. And so I think I can build an electric car out of cell phone batteries. And I'm sure everyone thought they were crazy, but they did it. And they proved that you can build an electric car that can go 200 plus miles with cell phone batteries. And then once they proved it, they started going market by market to provide electric vehicles for whether it's a sedan or a family car. Now they're doing trucks and small cars. So they're going market segment by market segment. But right now it's obvious that the world's moving electric, right? Because, as a mechanical engineer, those electric motors, infinite torque, like that is fantastic. In addition to the environmental kind of values there, right? So everyone thinks it's obvious now that that's a better way to do transportation. So our view is, and we need to serve all of these markets. And yes, we offer employer plans today. We're launching our first self-funded employer plan in January. With a large national employer that we're very excited about, and are rolling out from there, because we can provide dramatic savings, not only just for consumers and members, but also for employers. The plan we're rolling out, we're 40% savings over the incumbent product while increasing access. And we think that our approach, like Tesla, is obvious. It is obvious that giving people more choices, more control, more transparency, tighter alignment and engagement is a better solution than the traditional approach to insurance, which is constantly increasing costs, and no one really knows, where it ends, right?
And in a system where, do you believe in like healthcare for all, in terms of that sort of view that's is being, many people align with, many people don't align with? Like, I guess knowing the ins and outs and the intricacies of the system based off of what you're seeing, the data that's flowing in and out, what would it take to get there?
Yeah, I mean, do I believe in healthcare for all? Absolutely. Like, I believe everyone needs to have access to affordable healthcare, good healthcare, right? It has to be. It's not just because you're unlucky and you come down with cancer, you shouldn't be financially ruined.
Yeah.
Right? So of course, the question is, how do we get there?
Yeah.
Right. And so our perspective of how to get there is we look at the US healthcare system. Our administrative costs have come out of whack with the rest of the world. And that is leading our healthcare costs to come out of whack with the rest of the world. So we believe you solve the healthcare problem by bending the cost curve, right, on the healthcare costs. And we think that our approach, by basically enabling people to pay for care directly, eliminates all of this administrative cost and actually lowers the cost of care to the actual cost of care, not the cost of care plus administration. And we think that unlocks so much economic value that we can solve the access problem and the cost problem in the US simply by taking that approach.
Got it. Patrick, I'd love to switch gears a little bit. This has been very eye-opening. But you're a dynamic guy, lots of energy, very articulate in terms of your communication. And I'd love to better understand you as a person. How did you get from mechanical engineering to insurance? And what, what was that transition, or you maybe came out of college or other degrees and then decided to be an entrepreneur? What sort of prompted that?
Yeah, that's a great question. Probably a long story, but no, like I said, I like to build stuff. And in every single job that I ever took, I always kind of thought about it as like, what am I going to learn here? I just constantly trying to figure out, like, how do I surround myself with folks that know a ton more than me and where I am uncomfortable so that I can learn. And I try to make a lot of my decisions also around people, like who can I actually learn from? And so that's, that led me from, engineering school to work at McKinsey to, partnering up with someone at McKinsey that started a company. So I got to join him and help build a company. And I was the first one. And I've worked at large companies, small companies, and along the way. And each way along the way, it's like, I feel like all of our only asset is time. And so I'm always trying to think, like, how do I want to spend my time? And so I always try to pick the opportunities that where I'm going to learn the most, be surrounded by the people that I am going to learn the most from. And that's kind of led me down the path to acquire the skills that I needed to ultimately start Sidecar Health. And this is my post. I like to joke, like, this is the last email address I'm ever going to have. Like, this is it. I'm on a mission for the next 20 years because our team feels like we can solve this problem. And if I hadn't made the decisions along our journey, like I would never have felt comfortable trying to tackle, I think we can all agree, is a ridiculously large problem that there's a lot of bodies buried on the path of trying to go ahead and fix it.
Yeah. It sounds like that thirst for learning is sort of inherent to who you are as a person. And something I like to ask is, through the entrepreneurial journey, like, what is inherent to you, if that is it, that thirst for learning and problem solving? And then what kind of skill set have you had to hone in or cultivate over the last few years as your team has scaled, as your company has scaled?
Yeah, I mean, certainly thirst for learning has been just something that has just been a part of kind of my journey along the way. I mean, as I would think about kind of where, how have we made things successful and how have we gotten started, I really think it comes down to people. Like when we are thinking about starting Sidecar Health, we actually started with culture. Like literally the first thing, what we called our first five. So my co-founder and our early leaders got around a table and started kind of sketching out, like, what do I want our culture to be? And making the investments around that, because we felt like the people, like everything we're doing is going to be about the people we're doing them with, right? We're very much a mission-driven company. The people that join our company want to be here because of what we're accomplishing. Obviously the work is rewarding as well, but like what we can do, like you should see our member stories of how unbelievable people think that our product is, and giving them access that they haven't had in the past, and affordability. And so starting with culture and the mission was really, really important to kind of the journey from there.
So how do you, as a CEO, cultivate culture in a distributed environment? We've been hearing a lot about, it's difficult now that you can't take folks out for dinner each month or each week, or you can't have these, water cooler discussions. Everyone's working from home, and it looks like it's going to stay that way, at least for a little bit. How do you think about that as a CEO and founder?
I think this is something we talk about all the time as a team. And it's funny, before the pandemic, we had 35 people. We currently are approaching around 200. Right? And so everybody was hired over Zoom, which, again, this is my third rodeo. And I got to tell you, I'm one of those folks that are like everybody in a room. And like, because I feel like the ability to gather around a whiteboard is so important with the development of a company. And yet this is really the pandemic, just like with everybody, this is not unique to us. It's like, this has really challenged our operating model in the way that I've been part of teams in the past. And so what we have done is kind of overinvested in collaboration tools like everybody has done. But I think that one of the biggest things that we have done is actually, and for me, it took me a while to get there, but like for this company, I hired a chief people officer. And I had never done that before, John. That was new for me, because very early on, it became really clear that like it's going to be even harder in this environment to create a culture that's trying to accomplish something hard if we don't literally put an executive in charge of culture. And how do we? It's not just about recruiting. It's about building the organization of fabric of where we're going to go. And so that was probably one of the most important things that we've done, and the team that Alex has kind of built around herself. And the second thing that we do is you have to set a tone from the leadership team. And there's little things that we do. Like, for example, I do a cultural kind of like an intro to Sidecar Health culture personally with every new employee, right? And it used to be one-on-one. Now it's kind of groups as people kind of come in. But like, I think it's so important that culture is about what we're doing, that like I'm taking time to say, okay, here are our 4 tenets of culture. Here's what they mean here, why it's important to us, how it's going to facilitate kind of your growth here, and how we're investing in you. And we have to start with that, in your first week.
Yeah. Can you give us a little overview of that? Very curious to learn how you're laying out, culture. I think it's, it's become something like the mission or vision of the company, where it continues. You lay it out as a North Star of the company, and you can continue to reinforce it. And that way, you try to make sure that everyone is on track. But sometimes, culture is also something that is, it's very nuanced, and it's hard to necessarily put your finger on it. It's sometimes more, a feeling as much as like words to describe it. So I'm curious how you lay that out to employees, and then how do you make sure that folks are, aligned with that as they grow within the company?
These are great. These are great questions, and I totally agree with you. It is more about feelings and a North Star than it is about words, right? And it's one of the reasons why I make sure to do the orientation personally, because I think it's critically important to kind of get the feeling right. And so I'm happy to give you our the 2-cent version. We actually spent an hour on this, if you can believe it. I'll try to give you the 30-second version. So our culture just starts with our mission. Like, we fundamentally believe that we can fix the U.S. healthcare system. We can make healthcare affordable and accessible for everyone. And so it starts there. And we're trying to bring people into our company that's actually really important to them. I mean, time, again, is our most valuable asset. So great people have the burden of many choices. So the folks that come to us, that has to be part of why they're here. So that's the first thing. And then we've got our cultural pillars, right? So our cultural pillars are, 1, problem solving, right? What we're working on is hard. We have to be willing to go ahead and we talk about it as finding joy, solving problems. It's a little nerdy, but that's who we are, right?
Well, yeah, and it's cool always for me as how that the culture can also start top down, sort of from the founders and their philosophy, and that was very much present in terms of how you spoke about yourself too.
Yeah, and it's not just me; it's all of us. In terms of, you look at our leadership team, and especially my co-founder Veronica. So that's kind of the first tenet. The second tenet is bias towards action. We're not looking for just like, gosh, that's possible. It's really like, this is how we're going to do it, and we're going to go. And that's really important for any business that's kind of being built, any startup especially ones with big goals. Our third is actually accountability, right? We need to be accountable to each other. Right? It's critically important that it's we are making commitments to each other based on what we need to get accomplished, and we're all trusting each other to accomplish those goals. And it's not just each other; it's also our members. So being accountable to each other and to our members is really core to us, enabling us to achieve our mission. And our fourth pillar is empathy. Right? This is healthcare, and we not only need to be empathetic with each other, because what we're doing is really hard, but empathetic with our members, and understand that this is a product where people are counting on us for some of the most important parts, most stressful parts of their lives, and we need to be there for them. And so those are kind of our 4 tenets, and over our 4-year journey, they really served us, I think, real well.
Kind of related, kind of not, but you think a lot about price and cost and in the market for labor and people, there is some level of you know, talent has gotten more expensive.
For
Um,
sure.
so how do you kind of balance these two goals or straddle these two things around finding folks that are aligned with the culture and then also finding folks um, that are that Sidecar can afford at different parts of its journey?
Yeah, I mean, there's two components of that. So, we kind of have two main tenets around kind of attracting talent, because it's clearly a war for talent. And like I said, great people have the burden of many choices. And so how do we as Sidecar Health be a place where people want to work? Well, it comes down to two things. One is really about scope. Again, I really fundamentally believe that it is our team's responsibility, our leadership team's responsibility, to be worthy of everyone's time here, right? Otherwise, people should be here, right? So, I like to joke that my job is to make sure everyone has enough rope to hang themselves. Otherwise, how are they going to stretch and grow? Now, my job is also to make sure no one hangs themselves and they're supported properly, right? But it's really trying to create a role where people can come in and have such immediate ability to contribute that they grow and they learn. And this comes back to kind of, as I think about my journey, I feel like what I've been able to do and accomplish has been because I've been able to be put into roles that really stretch me. And so we as a team want to make sure everyone on our team is stretched. So that's the first thing, because people will learn and they'll be fulfilled because of that against our mission. And the second thing is just straight up compensation. We're very lucky in that what we are doing can fundamentally reshape healthcare. And so as we're a young company, but we're fortunate enough to kind of, if valuation is a milestone, to already be a unicorn just a few years in, kind of communicates that the amount of value that can be created by working on this mission. And so, can you get paid more cash somewhere else? I'm sure you can. But your ability to come in here and really contribute on something meaningful, grow as an individual, and then do well because of what we are accomplishing is, I think, unprecedented. It's the combination of those two things about value for personal growth, and then there's of course the compensation piece. But we don't think that we think that we can be extremely compelling around compensation as well.
Yeah, it's not just dollars and cents. It's also how you're treating people, how you're appreciating people, how people's connection to the mission of the company, and how they feel about being there. Connected to the culture. Last question I have for you, and it's sort of selfish, is how do you make sure that when folks are performing at such a high level, that you're helping them be proactive about burnout, that you're helping them cultivate maybe some level of work-life balance as they're working from home, and investing in well-being so they can have the stamina to work sustainably, throughout the journey of the company?
I think it's a really important question. And it's part of the reason why we have our chief people officer, Alex, who is helped guiding us. And there's little things that you do in terms of taking breaks. We very regularly have, learning hours where anybody can kind of talk about anything work related or non-work related that we make available to folks. We just like a lot of startups, we have a lot of team events that are done remotely or virtually. Some of them have been awesome. Some of them, it was a good idea, right? Yeah. I'm sure you've experienced that as well. And so there's kind of the formal things that you do along the way, but then you have to combine that with the informal things. And that's about I think that's about the leadership setting the tone, right? Like, I make time to work out every day. Should I work out more? Absolutely. But I definitely make sure that that's part of kind of my schedule and making it aware. And what we do is we constantly are trying to let people know that, like, you need to go ahead and do what's right for you. We can't tell you what's right. All we can do is say that, like, look, like, you need to take time for your family, for yourself. And we need to create the space in engagements around that. And then, of course, there's additional programs that, like, Alex works with, of introducing great products for benefits, access to great health and wellness services, so that there are specific tools to folks that need a little bit of help to get the most out of their daily lives.
Yeah, it's interesting. Even as I've talked to folks in the people leadership, department, and founders and executives, there's one camp of thinking that believes, like, folks have the autonomy and independence to sort of choose what's right for them, and it's, as adults they can create and carve out the time to exercise. And then there's, and some folks feel like, companies aren't your parents. They don't need to, like, watch over you like a hawk to make sure that you're doing these things. So it's interesting to dive into. Patrick, this has been awesome. I'm excited to meet you, hopefully in person at some point, because we're both in SoCal. Um, Love the mission of Sidecar Health. You've kind of sold me on becoming, and maybe many others, on becoming a member, or at least looking into how this could help from, a cost standpoint as well as an access standpoint, in terms of prioritizing the best quality care and not necessarily needing to pay an arm and a leg for it. So very excited and grateful that you made it here today. Anything that you'd like to end with that maybe we haven't covered, or that you'd like to add before we sign off today?
No, I mean, I really just wanted to go ahead and once again, thank you for taking the time to notice us. I feel like you're a co-conspirator on our journey to improve health in the U.S. And health at employers. So it's really great to get to spend some time with you.
Likewise. Thank you. Yeah, let's spread the health.
Absolutely.
Thank you, Patrick.
Thanks, John.